And welcome to the Live at Kigali session on the India-Africa Partnerships to Accessible Health. Good morning and welcome to all those who are watching. I'm Priya Balasubramaniam Kakkar from the Public Health Foundation of India. I'm a senior public health scientist there and the co-founder of the India-Africa Innovations for Universal Health Coverage Partnership. I'd like to welcome on today's panel my colleagues. We have Stacey and Pillay, who is the Chief Executive Officer of the Africa Health Placements, a social benefits organization based in South Africa that works on human resources in health solutions. AHP has facilitated the placement of almost 4,350 health workers and hundreds of doctors in serving in underserved areas in Africa. So welcome, Stacey. Good to have you on board. And I also have with me Dr. Faith Odwaro, who's the founder and managing trustee of the Mazira Foundation, based out of Kenya. Mazira is passionate about medicine and compassionate about people. And she's also a surgeon, a social entrepreneur. She works with communities to promote preventive medicine as well as advocating for affordable, accessible, and quality health. So welcome, Faith, and delighted to have you on this session. So today's session is really about partnerships. It's about accessibility, and it's about health. And the focus is India and Africa as a continent of many countries. India and Africa, as you know, have much in common in terms of developmental aspirations. We have similar legacies of colonial history and also have kind of inherited similar institutional architectures across the board. We also have comparable problems. And I think it's here where I think these partnerships or regional partnerships really come into play. And within this, India as a country, as well as many African countries, are also kind of inching their way to achieving broad-based goals on health and equity, like universal health coverage, and more recently, the Sustainable Development Goals. Historically, India has engaged with Africa in many areas in the health sector. And this includes community health resource development, institution building across the board, as well as human resource compatibility. But over the years, I think the partnership has gone beyond trade and conventional partnerships. Trade, because the generic drug industry in India has had a huge impact in Africa, especially in the formulation sector. Pharmaceutical exports have actually grown from 250 million way back in 2000 to almost 3.5 billion in 2014. But I'd like to discuss in this conversation a little more intimately that goes beyond mere trade partnerships to real capacity building between a country and a continent. And part of that is where can India and Africa really exchange ideas as well as collaborative partnerships around human resources, technology, health innovations, and diagnostics. So I'd like to start this off by really asking the two of you to tell me a little bit about where you come from, given the kind of work that both of you are doing. And how does this relate to your vision of regional collaboration and what that really means to you? So Faith, why don't I start with you and then...
Thank you. As a surgeon and working with the Mazira Foundation and interacting with the community, I look at this both as a service provider and a social entrepreneur. And just looking at the long history, like you have said, India, Africa has had long-term fruitful partnerships. And in development of cooperation in this area of health, we've had India-Africa forums which was devised in 2008, and we've had about 3 other forums after that in 2011 and 2015. And all this is just to strengthen the cooperation. And talking about Kenya, there's been goodwill from the government of Kenya in regards to India-Kenya cooperation. And right now, as Kenya is rolling out its universal health care, I see an opportunity where we can learn from India's best practices in how to implement our universal health care.
Great. And Stacey, tell me a little bit about yourself from the human resource perspective.
Sure. So, as you know, I come from a rural area in South Africa, and my organization really works to get healthcare workers to where they are needed and supports them and their colleagues to have the tools that they need to make people and systems better. And as you alluded to, a great example of how the India-African partnership has worked is our collaboration in terms of pharmaceuticals. And not only pharma companies, but actually the pharmaceutical laws in India that support the development of these generics that have actually reduced the cost of ARVs to less than $1 a day. South Africa has the largest ARV program across the world, and this has helped us keep 7 million people on treatment. So if you look at the impact of this kind of partnership and what it can have on people on treatment, on human resources and health, there's endless possibilities. A specific area that India has been very successful in is in the last decade, the number of medical schools have doubled by the inclusion of private medical schools. Now in South Africa, we don't have that provision in our legislation, but we could learn from India in terms of how that could help us with our production of healthcare workers and also how they are trained and deployed. Thank you.
Great. So now I'd like to get down to a little bit of the specifics with you, Faith. I mean, one of the areas that India is really looking to build on, and has also, looking at how Africa has also kind of leapfrogged on, is really the role of technology in healthcare. And India has a lot to learn actually from Africa and the way a lot of technology has leapfrogged in the continent, where mobile technology is now used for a range of services, from accessing health services to vaccination warnings to even payment for health services. So in your opinion, as a doctor and a physician, what is the role of health technology like in relation to low-cost diagnosis, the advent of telemedicine, and medical tourism in fostering partnerships between countries like India and Africa, regional partnerships? Do you think that this is sustainable in the long run?
Well, I'll start with medical tourism. Statistics, according to the National Health Insurance Fund, indicates that about 10,000 Kenyans are seeking treatment in India annually. And most of these people, honestly, are spending what they do not have to access healthcare services. So India-Africa partnership should start focusing on improving the health systems in Africa so that there is health equity and financial protection. Yeah, because and this can be done through transfer of health technology, and like you've mentioned, telemedicine. We can, and digital medicine, where we will probably be using nurses to have consultations with other specialists. Yeah, just to make it easy for people to access health without having to spend what they do not have. Yeah, and this can be done in different ways. Training of doctors, yeah, and making sure that our health facilities are up to standards, so that people are confident to actually seek services from our facilities. Yeah.
Great points. I'd like to move on to you, Stacey. Africa has made some tremendous inroads in innovating in capacity building, especially around your frontline health workers. I think the world has a lot to learn with the kind of innovations going on in empowering them. What kind of human resource partnerships do you think can be facilitated between these regions? And can technology play a role?
So definitely technology has a role, but we have to look at the local needs as well and how that is sustainable, to your sustainability question. You know, India and South Africa struggle with a similar problem. Only 12% of our doctors supports 84% of our population in rural areas. And in India, only 20% support the other 80% of your population. And there's been a lot of talk around your parliamentary committee and having obligatory service. Now, this is a specific area that South Africa has been running our obligatory service program, community service program, for the last 20 years.
And by obligatory service, you mean rural posting?
Yes. So really to address the issue of maldistribution of health workers, because as you and Faith alluded to, we will never have enough health workers, nor enough resources to get healthcare to those who need it the most. But we can work on more equitable distribution of health workers, and one of the ways is a kind of obligatory service, and India is proposing that all medical students who graduate from an Indian medical university go out for a year at a rural posting and do service to address this inequity. Now, we've been running that for 20 years in South Africa now, straight after internship, and we have amazing research on what are the push and pull factors for young doctors, especially who go out and work in rural areas. We also know this is a very impressionable time in a physician's career, and there's lots of strategies that we can use to build their resilience, which we are now testing as Africa Health Placements that we can then adapt for delivery in India. So we need to learn from each other's mistakes, but also technology is a way to make scale, to make accessible not only to healthcare workers, but also to patients. But what we struggle with in South Africa that I understand is not a problem in India is connectivity. And also that our populations are so sparsely distributed. So even in Kenya, the connectivity is better than in South Africa. So that's something we'd have to look at to see if technology can be incorporated, the amazing technology that's being developed in India for use in South Africa, but also an exchange in innovations, as you said, because we're experiencing a different set of problems, but coming together could help us learn from each other's mistakes. Yes.
Great points, all. I just want to kind of touch, take off from your point about scale and innovations. And I think what India is really grappling with is that there's a lot of technology innovation out there. Some of it incubated privately, and a lot of it incubated by the government. And technology spans an array of spectrum, from primary health care to mid-level, care, to high-tech, involving quaternary care in health. And I think the future of how a country like India is even going to begin to look at health reform is to see whether innovations can actually be bundled. That there are so many discrete innovations that eventually one will have to bundle them to be able to access them. The second point is also around scale. And scale involves multiple stakeholders. It's not just the health ministry. It's going to involve a whole range of non-health stakeholders who can actually take innovations to scale. And the last is, I think, something that's kind of echoing repeatedly in a regional setting is when you have digital disruptors that are going to be scaled eventually, how do you regulate them and who do you hold accountable? I think examples like Uber or Facebook, for example, have huge implications for data privacy. We have sessions and other panels at the Kigali dialogue discussing some of these. So what do you think, from your perspective, are some of the challenges in these kind of partnerships? And what do you think some of the solutions could be when we're looking at regulation and accountability? Start with you, Faith.
Allow me to answer that question with a question.
Sure.
Is there commitment and is there willingness to increase the health budget?
Okay.
Because these are questions that will determine if this partnership will actually make a difference. And is there willingness to train, for instance, the medical professionals? Is there willingness to make sure that the working conditions are improved? And is there willingness also to ensure there is regular and sufficient supplies of medical equipment and other supplies? And these are questions that, I mean, we have to be very honest when coming to the table.
So do you see the government as a regulator or as a committer to funds? Because I think part of this argument is that the state can play a limited role. And part of regional partnerships is to say that given that there is inherent deficit of state capacity in achieving certain things, can we use regional partnerships to be able to fulfill some of those capacity gaps? Where do you see that going?
It will work, but we have to be very honest with the challenges that are already being faced at the moment.
Give me an example of a challenge.
Yes, I will talk about Kenya, for instance. If you are thinking about partnership, probably in equipping the hospitals, are we also investing in training of our medical professionals to use the same equipment? Because it wouldn't make sense to spend so much money to equip a facility with things that are not going to be used. The people are not trained well enough to use them. Yeah, so we have to be very honest with what challenges we are facing at the moment and what are we going to do about them as we come to, agreement in how to partner.
Good points. Thanks, Faith. Stacey, let me hear your perspectives on the same question.
I think it's time for us to acknowledge as developing countries that the public sector and the state alone cannot provide what we need in this economical climate. Also, we are living in a place where there are many different actors, social enterprises, that kind of thing, and people who are committed to social impact for people to live healthier, longer lives. And we need to be harnessing that. In my humble opinion, if a provider is responsible for the care of 70 to 80% of the population, then they should be leading that dialogue. So indirectly, what I'm saying is that in my country, our public sector should be leading. Definitely a good example of where it's worked is our good president has called a presidential health summit for civil society as well as the private sector and the public sector to come together to look at what actions need to be taken in the short to medium term to turn around our health system. I definitely envision a health system that where the public sector is definitely not the payer and the provider of all services, because that will not create equity and accessibility as well as quality care. The truth is that we want the innovations to happen, but we want them to happen for the benefit of a whole community, not an elite group to perpetuate the inequity. So they definitely need some leading to be happening, but collaboration in a space where we're working towards the same goal for us to really pull off universal healthcare coverage.
Great points. I think we're almost out of time, so I'm just going to use this for a few summary points from both of you. And I think one message that I really take away is that partnerships are constantly evolving, and one has to really deeply look at local context before we make commitment. The state plays a very important role in being able to define those partnerships within regions and between countries as well. And I think that's something that one has to take cognizance. Technology is going to play a huge role in the future, but one has to be careful of how it's regulated and whether countries are really prepared for the kind of technologies that we want to exchange. So with that in mind, my last question is, what kind of health partnerships do you see happening in the future? And how do you envision building health systems capacity at a country level with the regional cooperation in mind? Just a couple of points from you, Faith, and Stacey, and we'll wrap up.
Well, I envision a partnership which has mutual benefits. We come to the table and we have to look at what's going to work for both parties. And we have to synergize our efforts, especially in achieving universal health care and making sure that health is accessible, and we improve on the quality and expand on coverage, for instance, through telemedicine, and also improve on financial protection. Yeah.
Absolutely. Stacey.
Of course, I'm always going to say that health is a people-to-people service. Technology is just an enabler. So I like the representation of the WHO building blocks of the health system that has people at the center of it. So partnerships will be led by people. Partnerships will be led by engagements and us acknowledging that what we're doing is not working in the healthcare space in most developing countries. But we can come together and leverage off our expertise in order to achieve the outcome we're looking to need. Because we do need to scale for impacts. The people we're currently getting to and the quality of services is not acceptable. I think we've all said that. But I think also there was a panelist from Chad who said the only sustainable efforts are a local effort in a country, especially in fragile health systems. And I think that we need to be taking the lead as people who are responsible for the healthcare of our people in order to foster the partnerships that have the political will to really make change.
Great points. I think we need to reinvent health systems with local contexts. And I think the time has come to make that pivot. Dr. Stacey and Pillay, Dr. Faith Odwaro, thank you so very much. It's been delightful.